Okay, so cranial nerve 1, if you remember, is the olfactory nerve and is responsible for carrying our special sense of smell. We don't often formally test it in clinical practice, but we may ask the patient if they've noticed any change in their sense of smell if we're doing a sort of comprehensive cranial nerve examination. So remember that the olfactory nerve, if we're being pedantic about things, is actually this part of the olfactory system or pathway. So if we bring ourselves right down here, just remember that the olfactory nerves are found in the roof of the nasal cavity. So this is the external nose and this is the nasal cavity. And the olfactory nerves run through the bone of the floor of the skull, through a part of the ethmoid bone, which hopefully you identified as being the cribriform foramina within the cribriform plate. So those olfactory nerves run perpendicular through that part of the bone, and we meet what is the olfactory bulb. And from there, the olfactory nerve is actually known as the olfactory tract. So remember, we have two olfactory bulbs and tracts because we've got one on the right and one on the left, so we're just looking at one here. So the olfactory tracts, as they run horizontally along the floor of the base of the skull, they run within the anterior cranial fossa. Okay, so we find them running along the floor of the anterior cranial fossa, and then we follow them into the brain. And as we know, the olfactory nerve is a little bit unusual in terms of a cranial nerve in that it's not a true cranial nerve, it is effectively an extension of the forebrain. So once that information has come in from the peripheries and arrived within the forebrain, it is perceived, the signals that come in through the olfactory nerves are perceived by the temporal lobe. Okay, so that the right temporal lobe will receive information from the right olfactory tract and therefore the right olfactory nerves, and similarly the left temporal lobe would receive information from the left olfactory tract and olfactory nerves. So the significance of understanding the route of the olfactory nerve, as identified in this schematic, is that there are relevant applications of understanding the route of the nerve to potential involvement as a result of injury or pathology. So if we start right at the beginning here, we know that an upper respiratory tract infection or the common cold can very commonly cause a loss of sense of smell or anosmia, and that's due to the mucosal edema within the nasal cavity. Another point is head injury. So because these very delicate olfactory nerves are running perpendicular through effectively perforations in the bone, that they are very vulnerable to a shearing injury when you have an impact to the head. So a head injury could lead to a cause of loss of sense of smell. The other point at which the olfactory tract can be affected is in any intracranial space occupying lesions that may involve the anterior cranial fossa. And finally, we know that there are a number of conditions that may involve the temporal lobe and therefore areas which are responsible for our perception of our sense of smell. A good example is temporal lobe epilepsy, where patients may, preceding a seizure, actually describe experiencing unusual smells or olfactory hallucinations as a result of electrical discharge within the area of the temporal lobe.